I'm Scott Menser. I'm Vice President of Sales and Operational Planning at Phoenix America. Phoenix America got involved in this project through University of Minnesota and Boston Scientific, looking at a simplified emergency use ventilator apparatus. What we do here at Phoenix America is we make speed position sensors and magnetic-based encoders for the purposes, typically, of motor control. We control motors. That's what we do best. And in this particular application, being able to precisely control a motor is key to the application and function of this emergency use venting concept. But after we got involved in this program, we looked at it, we looked at the crisis that our country was going through, and we felt like we could bring a full mechanism to scale very quickly using a lot of Northeast Indiana regional partners. We have been interfacing with a number of our customers, a number of our suppliers, all in the Northeast Indiana region, and this device is based on those relationships, and we feel like with this design concept, we can be producing 2,000 to 3,000 units per week in a matter of just 2 or 3 weeks. Our team has worked hard to put this prototype together. We're actively working with Trine University in a collaboration effort to make sure that we're meeting the needs of the users. We've got great relationships with local medical professionals giving us advice and guidance. And we feel like we can use this situation to keep our employees employed, working, and building something that can aid the country and potentially the world in this crisis. Even beyond this crisis, as we continue to learn about how pandemics can impact the world and the health of the world, I think we all see a need to potentially have these units available in a stockpile situation. A typical ventilator costs between $25,000 and $50,000. We feel like we can build this unit for 5 to 10% of that price. And countries can stockpile it, states can stockpile it. It's a device that will always be ready, will never go out of date, will not need maintenance while it's in stockpile, and be ready for use in case we have another emergency like we're going through now. I'd like to thank all of the Indiana partners that have offered assistance to us. Since we first made this announcement, we even had someone step forward and offer us 10,000 square feet of manufacturing space free of charge just to be able to scale this project up. That's the kind of Hoosier entrepreneurial spirit and cooperation that we need to attack this crisis in a moment of need. Our employees stand ready to fill the gap should our country need it, and we're excited about being able to do that. This is a humanitarian effort. This is an effort to be an active participant in fighting this virus.